Now we'll move to English session. Thank you, everyone. Welcome to today's English section. And now we'll begin with a silent prayer. Welcome once again. Thank you all the participants for joining with us. And today is our 1440th day of continuous webinar. All of you are aware about our continuous webinar without any break and without any leave. And thank you all the faculties for sharing your knowledge here. And today's our guest is Dr. PADMAPRIYA NAIR. She's joining from UK. All of you are very familiar about Dr. PADMAPRIYA. Dr. PADMAPRIYA has joined. Okay. Okay. I'll make you as a co-host. Dr. PADMAPRIYA is familiar to everyone, and she is the person who introducing many rare remedies here, and she got much knowledge from her father. Normally we say that persons never dies because whenever they are in our memory. Whenever PADMAPRIYA is taking the classes for us, we all remember her father, and we respect him as an eminent physician. And she's giving many knowledge from his father. Thank you so much for giving us such knowledge. Today's her subject is about migraine. I'm inviting PADMAPRIYA, and no need of any introduction. She has done her PG from UK, BHMS from India, and she's practicing there for 26 years. And I'm inviting Dr. PADMAPRIYA, please.
Hello. Am I audible?
You're audible and visible.
Okay, thank you very much. Before I start, I would request you to do me a favor. I could hear some network error during the Hindi session for the last 10 minutes. I could not hear anything Dr. Mridul was saying. So there was some network error. So in case if I am not audible or visible, please stop me so that I can restart from where I go silent.
Now it is clear.
Okay. Okay then. Okay. Yeah, so very good morning, good evening, and good afternoon to everyone present here. Thank you very much for giving me this opportunity to talk here on this international platform. And thank you very much for that kind introduction as well. So before I start, I always do this. All that I have learned is from my father, who was a very successful homeopath back in Mumbai, India. I learned a lot of homeopathy from him, especially the practical aspect of homeopathic science was taught to me by my father. And of course, being in Mumbai, I was always exposed and surrounded by absolutely successful, eminent, well-known homeopaths of India. So I also got great opportunity to personally learn a lot from other homeopaths as well. And now I'm based here in UK, London, and it was very nice.
Learning and knowledge will pass through generations.
Yes.
So the typical example for that, whenever you are taking the classes, you as my father's knowledge, whenever you are talking, your father is living in this world.
Yes, because I think our science, especially our science, homeopathic science, is such a beautiful science that one person cannot learn by reading one book or 10 books or 100 books in one lifetime. The best way to learn homeopathic science is to learn from teachers, eminent teachers.
Yeah.
And
Exactly.
I feel I am really blessed that I was always had these blessings of teachers or the so-called gurus who have always taught us. And even here in London, I do attend seminars or webinars as much as possible so that I get to learn a lot. Because even today, I feel I don't know exactly what is written in Stuart Claus or A. Roberts, but I know everything that Stuart Close and Roberts have said because I have learned from the teachers who have read those books, So I have not read all the books, but I know what is there in the books because of all the teachers who has blessed me with their knowledge. So again, today here in IFPH platform, I'll be sharing less of what I might have practiced and more of what my teachers have taught and more of what I have learned from the seminars or webinars. Okay, and as introduced, I'll be talking about management of migraine cases. So as we all know, migraine is one of the most common diagnosis a patient comes up for homeopathic management because as we all know, painkillers and painkillers. Nothing else can be given for migraine patients. And we do have lots and lots of patients, and every one of us do come up with cases saying a chronic case of migraine or acute case of migraine. So, and we all are well versed with the common medicines that we all use because right from our academic life onwards, we have been taught a list of medications and we do get success rates, high success rates with that list of very famous, I should say, well celebrated homeopathic polycrest remedies, which we use both in cases of chronic migraine or acute migraine cases. But still, in spite of this vast materia medica knowledge, I'm sure I have experienced failures, and many of us do get cases wherein we are giving the best medicines. We have done the best possible case taking, we have done the best possible minimum, and we have done the best possible potency management as well. But still, we get patients coming back to us in the follow-up consulting saying the medicine is not helping, or else the best prescription may go wrong, or the best prescription may not give 100% success rate. So there are absolutely experienced clinicians, I should say homeopaths, who are always successful with their prescription. Especially, as I said, my dad was one such personality. I had Dr. Milind Rao. He was another master whom I met in Mumbai. He was another great pioneer in my homeopathic life. So there are many others who finish their prescription in, say, 15 minutes or 20 minutes or maximum 30 minutes of case taking, and their prescription always goes right. But a great chunk of homeopaths like me and many juniors, I should say, definitely, we do struggle. We do struggle with finding the right simillimum. We do struggle with the patients coming to us and saying, doctor, your medication did not work, or else it just partially gave me relief, or else it was better last time, but I'm again back with the same problem. So how do we manage such cases? So as rightly said, again, this is one of the clinical tips that I have learned from my father, management of migraine cases. So let me share my slide before I go ahead with the preparation. And let me know if the slide is visible.
Yeah, you can share now. Please share. Yeah, it's visible. Yeah.
This is okay.
Management of migraine.
Yeah. Okay, so we will just go through this and understand how migraine can be managed efficiently. As I said, all my salutations to my guru. Everything that I am sharing today is because of the masters who have taught me. This is my father, one of the most important pioneer personalities in my life, who introduced and who taught and who helped me walk through this journey of being a homeopath. This is the Dr. Milind Rao, the greatest master who has I mean, I can't explain what he has given me, everything else, what my dad could not give. So he is one of the greatest personalities. So salutations to my masters. So going ahead, after this, I am talking about the cases. So as I said, this is when I was discussing what goes wrong with my prescription with my father. So my father clearly just gave me a very simple solution to handle migraine cases. He said, we get cases. So the first and the most important thing that we need to understand is what is the type of case that you have in your hand. So there are clearly only two types of chronic cases that comes to us. One, on the green icon with the two eyes is the case which is very, very clear to the eyes of a homeopath. So when I say very, very clear cases, that means what do we homeopaths need? We homeopaths need a clear totality of symptoms to reach the simillimum. So how do we get the clear totality of the case? We need characteristic PQRS. We need the typical location, sensation, concomitant modality. We need a clear data. So whatever your type of prescription is, you need to have a clear set of symptoms to come to a conclusion that I am done with my case taking. Now I know what could be the possible prescription. So that is this green icon. So with great clarity, you can see your case with great clarity and with great confirmation, you can be sure about what you have in your hand as known as a totality of symptoms. And then you're sure about your prescription. The second type of case is the one that I have shown in the orange icon, circular icon with a magnifying lens. So what does this mean? These are the type of cases which does not show a very clear drug picture or a very clear symptoms are not exhibited by the patients. So when you come across such cases, these patients do not give us a clarity of symptoms. So what does this mean? This means that we need characteristic PQRS symptoms. We need clear idea about what the location, what the modality, and what the sensation is. But these patients are not able to give us. One could be, the one reason could be it's a chronic case, they are not sure. And the second and the most important reason, especially in cases of migraine, is these patients are always under the influence or under the so-called action of painkillers. So most of the time, chronic migraine patients who come to us will definitely come and tell us that I am a chronic case of migraine. Whenever I go to sun, I have to take my painkillers because I know the sun is going to give me a headache. When the periods are coming around, I do take painkillers because I know my premenstrual days are going to be miserable if I do not take painkillers. I've got my exams and preparations coming. So whenever there is this class submissions or project works or deadlines or exams coming up, I definitely put myself under this course of painkillers. So what are this kind of patients? So these are the kind of patients which can be known as contaminated cases. Okay, so my father always asked me, and especially when I came here to London, and if I'm discussing a case with him, the first question will be, is that a clear case or is that a contaminated? So what do you mean by contaminated case? Cases which are always under the influence of so-called medications which are suppressing the symptoms that we want as homeopaths. So here, it could be anything. It could be steroids or antibiotics, antipyretics, or painkillers. We are talking about migraines. So I'm saying the patients who are constantly taking painkillers and then coming to us saying that I am a patient of migraine, they are the patients who are known as contaminated cases or patients with no clarity of symptoms. So understanding this is very important because we all homeopaths are being trained. We all homeopaths are experienced with how to manage a pain of head that is known as headache. So here I am clearly not talking about headache. Headache can be very acute. So we all know, we all have the standard belladonna, spigelia, sanguinaria, natrum, whatever. I am not elaborating on the list because we all know that. So headache can be managed with those set of medicines. Acute cases of migraine, again, we can manage all acute cases of migraine with well-celebrated remedies that we know. Chronic cases of pure migraine. So when I say chronic pure cases, that means the cases which are not suppressed. People who are well oriented with homeopathic medications or people who, there are many in this world who believes in natural ways of treatment. They might take some hot water, they might go to sleep, they might put some eye patch, or they might just inhale some camphor or some kind of anything that is soothing for them. So they do not take medications. They just come to us saying, I have this menstrual headache, I have this sun exposed migraine, I am a chronic patient of migraine, but I do not take any painkillers, doctor, but I want to get rid of this now. So in such cases, absolute constitutional remedies, well-selected constitutional remedies do help in chronic cases of migraine, which are very pure, which are not contaminated. Today in this session here, I am going to discuss about how do we proceed with chronic cases of migraine which are absolutely contaminated. So I just want to make this very clear because in one of the presentations of the same topic, I got many questions where there was lots of confusion. So again, I'm going to repeat here in this session, I'm talking about remedies which can be used in the management of chronic cases of migraine, which has been suppressed by painkillers. I am not talking about the remedies for headache. I'm not talking about the remedies for acute cases of migraine. And again, I'm not talking about any constitutional prescription which are always successful for chronic cases of migraine, which is very pure, which is showing 100% clarity of symptoms. Okay. So we are discussing only about the cases with no clarity of symptoms. So the patient is always dependent on drugs. So what is happening? We do not have a clear drug picture. So let us understand where is this mentioned in our Bible. Our Bible, Organon, in Aphorism 91. Okay, before I proceed, am I very audible? And is the slide visible? I think it's all good. Okay,
Yes,
so, okay, thank you. So, Aphorism 91, I am just reading out this aphorism. The symptoms and the feelings of the patient during a previous course of medicine do not furnish the pure picture of the disease. So here Hahnemann has written that the symptoms and the feelings. So whatever the patient is having, they do not furnish a pure picture of the disease. But on the other hand, those symptoms and ailments which he suffered from before the use of the medicines or after they have been discontinued for several days gives the fundamental idea of the original form of the disease. And this especially the physician must note of. This is what I exactly told just now, that Organon is explaining the same thing. Hahnemann is saying that the patients have been on certain medications before the treatment, before they come to us, and they have been suffering with those set of symptoms. But they are not giving us a pure picture of the disease. Okay. But after they have discontinued for several days, this medications needs to be discontinued for several days so that the true fundamental idea of the original form of the disease. So Hahnemann means to say that if you homeopath wants a true fundamental idea of the original form of the disease, you need to discontinue for several days. Now, in today's world, if a patient of migraine, a chronic patient of migraine is approaching a homeopath, that itself means that he is tired of taking painkillers. He is exhausted by the amount of episodes he had in his life of migraine, followed by with painkillers, without painkillers. So he is exhausted by that cycle. That is the reason he has approached to us. So in such a situation, if this patient is being told that, okay, I'll give you a remedy, but you have to discontinue your painkillers for some days, and then you come to me so that I give a drug picture, I get a drug picture. So do you think this is going to work out in today's era? We are all living in a fast world. All of us, our patients and us, we all need everything very quick. We need everything very fast. So we cannot afford to send back a patient saying that I'm not giving you a remedy, you have to discontinue your painkiller and then you come back so that I get a drug picture. This is not happening. Okay. So now let's understand what is in the second paragraph of the same aphorism 91. Now, Hahnemann says that when the disease is of chronic character and the patient has been taking medicine up to the time he is seen, the physician may, with advantage, leave him some days quite without medicine. That means if this patient comes to us who has taken painkillers until today, he might leave the patient without medicines. And that is what I just now said, we cannot afford to do that. Hahnemann mentions or, which means there is another option of handling the situation. He says, or in the meantime, administer something of an unmedicinal nature. So Hahnemann is saying you can administer, that means you can prescribe something which is of an unmedicinal nature and defer to a subsequent period. Defer to a subsequent period means you can prescribe this kind of an unmedicinal nature remedy for a particular number of days and defer to a subsequent period, the more precise scrutiny of the morbid symptoms. That means whatever the morbid symptoms, the disease symptoms, whatever symptoms the patient is coming and telling you about his migraine, You just give him a remedy based on that particular, maybe few morbid symptoms, in order to be able to grasp in the purity the permanent uncontaminated symptoms of the old affection. So what Hahnemann is saying is, if you do this, you will be able to grasp, you will be able to catch hold of the permanent uncontaminated symptoms. So Hahnemann has very clearly said this. Give some medicine, prescribe a remedy for some. He is very clearly mentioned it for subsequent period, for little period. And based on what? Based on the scrutiny of the morbid symptoms. Based on that few morbid symptoms, you prescribe a remedy. Then you have to wait. What is that waiting period? He has said subsequent period. And then he's saying the patient will come, then you will get the uncontaminated permanent symptoms. What do you mean by permanent uncontaminated symptoms? Whatever the symptoms was originally before the taking painkillers, those are those symptoms. And that is the old affection. That is the symptoms of the old migraine. And that is going to give a faithful picture of the disease. So whatever I said just now was all mentioned in this aphorism. So understanding what Dr. Hahnemann said in aphorism, this is all that we have to do. Okay, so what are the things that we have to do? We have to do is, sorry. Okay, in such cases, the blue highlighted lines in my slide is from the aphorism 91. Aphorism 91, Hahnemann said, in such cases, in the meantime, administer some of the unmedicinal nature and defer to a subsequent period the more precise scrutiny of the morbid symptoms. Again, the same things as I mentioned earlier, I have just represented the same in the slide. As the arrow goes from the left side to right side, you can see that what you do first is, in the orange block I've written, prescribe a medicine which has predominant action on the main vital organ. I'm sorry, if the host can add all those people waiting in the room. You know, there are 8 people in the waiting room, and I'm getting that pop-up notification on my screen. So kindly admit them, host.
Yes,
Sorry
yes,
about that, and thank you. It's popping up on my screen. So sorry, let me continue. So as said in the orange block, prescribe a remedy, the medicine which has predominant action on the main vital organ. So what is the main vital organ? Today in my session, I'm talking about migraine. Okay, so it could be asthma, it could be arthritis, it could be any particular organ that you want. So you have to prescribe a remedy that is on the main vital organ that is affected in the case can be prescribed on the basis of few available symptoms. Again, in aphorism 173 and 178, Hahnemann has explained in detail how do you prescribe based on very few available symptoms. So based on that aphorism, you can make your prescription. Then going on forward to the green box, then gradually the conventional drug is withdrawn. Okay, so we need to understand what happens between the orange box and the green box. So the patient is coming to me, contaminated case of migraine. So I have to give some medicine based on the few symptoms which the patient has exhibited in my consulting room. I give this medicine and then I have to wait. I'm waiting for a subsequent period of time. Then what is happening is this remedy which I have prescribed is going to tackle his pain. When this medicine has been given, he is taking this medicines, he will not feel it essential to go and take painkillers. So when we prescribe this remedy, we need to tell them that before you take painkiller, whenever the intensity of pain is there, you have to take this homeopathic medication. So when the patient is doing this, he is not taking painkillers. And eventually what happens, in what I have learned from my master, especially my father, he used to prescribe this kind of medicines for just 10 days or maximum 15 days, not more than that. So subsequent period, as mentioned by Hahnemann, can be defined by you all individual homeopaths. Ideally, I've seen the masters doing it for 10 days maximum. So between orange and green is that 10 days period wherein you have prescribed this remedy, the patient is taking this remedy. Since the remedy is working on the patient's migraine headache, he is not taking the painkillers. So now what is happening? He is not using the painkillers as much as he was using before. That is where Hahnemann is mentioning that gradually the conventional drug is withdrawn. So the patient is no more on the conventional drug. Gradually, the patient is coming out of that dependency on the conventional drug. Then in the blue box, it is mentioned that then suppressed symptoms resurface. So what is happening from the green towards the blue? the patient is taking the so-called homeopathic prescriptions. The patient is not dependent on the conventional remedy because he is getting benefits from our prescription. Since he is not taking the painkillers, he is slowly coming out of the painkiller dependency, and then he's also exhibiting the old symptoms. So all the suppressed symptoms which were suppressed by the painkillers is resurfaced. Now we'll discuss about the pink block, that is patient gives more clear modalities and pictures. So what happens? Subsequent period of 10 to 15 days, we are giving this medicine. Eventually the patient is showing original, absolutely pure symptoms, and that is nothing but very clear PQRS, or the very clear location sensation modality, and that is what we as homeopaths need. And that is when we can hit the simillimum. We say, as I said, great masters always do that. They give one prescription and that turns out to be the simillimum. That helps the patient a lot. So in such case of contaminated cases, if we follow this kind of a protocol, or if we follow this kind of a model for prescribing in such contaminated chronic cases, we can also reach a state where we will get a clear drug picture and we are prescribing the simillimum. Okay. What happened? My slide is not moving. Okay, so now, sorry, there's a lot of spelling mistakes in this slide. I'm sorry about that. So now I'm talking about the migraine, which are dependent on painkillers. So here I'm discussing certain remedies. Okay, so these are the remedies which, again, before proceeding, I'll tell you, these are the remedies which could be rare remedies. These are not the so-called polycrest. These are not the very commonly prescribed remedies. These are the so-called rare remedies. And this list of rare remedies that I'll be discussing today, especially in cases of migraine here today, what I've learned from the masters is you prescribe this rare remedies in the mother tincture form. And when you give this in the mother tincture, you always ask the patient to add 1 or 2 drops in a cup of water and take this medications for 15 minutes. If the pain is better 30 minutes, then it's still better. Repeat it only after 1 hour or 2 hours. So that is how mother tinctures are prescribed. And this set of remedies are so-called rare remedies. Again, I'm saying this set of remedies, I mean, during some kind of discussion with other homeopaths, I've seen homeopaths prescribing this for cases of headache, for cases of acute case of migraine. Yes, you do get successful results in this prescription as well. But in the books, see, this IFPH is a platform to share experience. I am sharing my experience. So in my experience, I have used very little of mother tinctures, but the textbooks, wherever I have read about this rare remedies, it mentions that rare remedies can be dangerous if you use it for quite a long period of time. So understanding how to use rare remedies is also very important. Okay, so headache. So I will be explaining about that in the further slides. Let me just explain about some of the common or some of the remedies that is commonly used for chronic contaminated cases of migraine. And this one of this is Ceonanthus virginica. So what happens in Ceonanthus is the patient usually come up with gastric symptoms. Most of the time it's nausea or vomiting. So reading from the slide directly, the complaints of head accompanied by liver complaints, accompanied by nausea with gastric complaints, and this patient always feels better by lying down. Amelioration is seen here. Saliva is too increased. This is a very characteristic of Ceonanthus. When the patient is sitting and talking to you also, you can see that there is too much of watering in his mouth. So there is too much of salivation. The patient might ask us or might need to spit out the saliva. So there is excessive accumulation of saliva inside the mouth. Although the patient will also say that, but I do feel there is dryness of mouth. This is a characteristic symptom of Ceonanthus. Saliva increase but feels dry. Also, there is sweat, but very, very cold sweat on the forehead. So this can be used for periodical headaches, menstrual headaches, or any kind of gastric headaches. This can be taken for several weeks, drop doses, but often break up the sick headache habit. So what is sick headache habit? Whenever I get this headache, I take a painkiller or else I lie down and I get up, I'm feeling better. Next time again, when I'm getting this headache, I'm using the same pattern, lying down or else I come up with my painkiller rescue. So if you take this as a mother tincture form for a couple of weeks, that habit of taking painkiller and bearing the headache and then coming after the headache episode, that habit is broken if you take this prescription. So the pain is mainly in the forehead and especially over the eyes. And the eyes are very painful, especially on the root of the nose. On this area, this particular root of the nose is where, patient while talking to you can also do this, and say, this particular area is very painful. So that is ionanthus. Okay, next very nice remedy which has helped me, especially in a lot of cases, to clear the drug picture in migraine is epiphagus. So what happens with epiphagus is it's usually given in cases, Borik is saying this, headaches brought on by overexertion, shopping, excitement, etc. So if you actually see, we very usually get this presentation in our family as well or within our friends, whenever there is a family event, if there is a birthday party or there is a wedding or any kind of celebration happening in the family, there's lots of excitement. Along with the excitement, the main person, the man of the house or the lady of the house has to do lots of running around. She has to arrange everything. She has to organize the event. She has to send out invitations. She wants to go ahead and finish with the shopping. So there is a lot of things running around. So there is lots of physical exertion also, but there is a great element of excitement also. But whenever such a situation gives headache, you should not forget epiphagus. Epiphagus is overexertion, shopping, and excitement. When these three combinations comes together, this is the best remedy. So nausea and general languor, severe pain in the forehead caused by unusual demand upon the system. So what is unusual demand upon the system? Obviously, when there is an event, even we don't host events every day, isn't it? It's not a daily episode. Going to school, going to work, doing your household work, these are the natural and the everyday event for everyone's life. But if there is a birthday celebration, that's an unusual exertion. If you want to attend a birthday party, or else if there is a wedding, you have to host a wedding. So it's a very unusual exertion. So our material medicals clearly said unusual demand upon the system. The system can be everything, the nervous system, the physiological system. So when there is a too much of exertion on the system, and if that is causing headache, epiphagus. Aggravation by rising and going about, always better by rest in a supine position and by sleep, lying down. So females, especially females, if there is a birthday party, there is a wedding, they'll come up. Oh, I don't take medications, or else I just take medications. But the best way I get rid of my problem, my headache, is I just lie down. So if lying down also keeps them better, sleeping will also give them amelioration. Pain is worst on the left side, especially on the temple, pressing pain on the temple. Constant desire to expectorate with viscid saliva. Again, in this remedy also, we will see too much of salivation in the mouth. And the patient wants to expectorate. This is very characteristic in epiphagus also. Headache can be preceded by hunger. This is another symptom we see. Most of the times patients do come up with, I finish with my food, but still I feel so hungry that I eat. And then I know this is a pattern that follows with me. It's always preceded by hunger. Headache from temple as if something pressing or piercing from out to inward. This is another characteristic presentation of this remedy. Okay, so I think this bromium, we all are well versed with bromium, but again, bromium for headache is given in potencies or in chronic cases of migraine also, we get great relief with bromium as a prescription. But if bromium is given in mother tincture form for 10 to 15 days in contaminated cases of migraine, we do get a great drug picture. So bromium is indicated if you see any of the symptoms. It's usually headache is on the half side of the head, not the entire head. You see, it's from the vertex. The headache starts from the vertex, and also you get pain extending to the jaws, pain extending to the nose, throbbing pain, very severe throbbing pain, especially left-sided pain, and there is a sensation of a bandage or a hoop around the head. So this is the characteristic symptoms. So when Hahnemann said that you can prescribe on few symptoms of the morbid state, these are the few morbid symptoms of chromium which can be used for prescription. Next, very nice remedy which can be used here in such scenario is Indium metallicum. Indium metallicum gives a very, very characteristic presentation. That is, there is too much of straining happening during stool. So basically, the patient usually complains of constipation. So, but when he's straining for stools, he will definitely come up with headache. So usually, this kind of migraine patients may not come for migraine, but patients do come up for constipation. So if that is a case of constipation, and if the patient says, every time I get this constipation, I have to strain, and every time I strain, I come up with this very, very bad headache. So this headache, which is too much on the temples and too much on the forehead. So you have this headache in the temples and forehead with sleepiness, nausea, weakness, and emptiness. Dull pain in the temples and forehead with nausea. Sorry, I have repeated that line. Gone feeling in the stomach about 11 a.m. Violent attack of sneezing. So this is characteristic. The patient do come up, very weird feeling. Gone feeling is written in the repertory, but clinically the patients do not explain, use that word gone feeling. Clinically, the patients will something weird happens, inside my tummy around 11 a.m. I'm finished with my breakfast and I am not hungry. I have a lot of time left for my lunch. So it is not a kind of hunger pangs. I am not hungry, I know that, but something weird happens, something weird feeling comes, inside my tummy. So this is a gone feeling of stomach about 11 a.m. Indium is a very good remedy for such a symptom. Again, another classic presentation is violent attacks of sneezing. Headache, usually patient comes up with the story, once I start with my headache, the sneezing doesn't stop. Also, sexual psychopathy is seen. So when I say psychopathy, it could be any kind of sexual symptoms a patient can come up with. Patient of migraine with intense sexual desire, no sexual desire. So any kind of, or dreams of sexual content in the dreams. So any kind of sexual pathology is seen in this patients of India. Now, the next remedy is iris versicolor. Again, this is a very common remedy. We all use this remedy. But as I again previously said, if used in mother tincture form for 10 to 12 days in cases of chronic contaminated migraine, iris helps a lot to clear up the drug picture. This remedy is indicated in hepatic derangement when there is a violent sick headache. It may appear as a dull, heavy headache in the forehead with shooting pains in the temple with nausea and vomiting. The headache appears regularly. It is preceded by a sensation of blurring before the eyes. It is aggravated by rest and is relieved by a continued motion. There is a loss of appetite with the vomiting of sour, bitter material. There is painfulness in the hepatic region and pain above the crest of ileum. The urine is dark red. The stool is soft, contain an excess of mucus, and the passage produces a sensation of burning in the anus. So this is the characteristic presentation of iris. Again, as I said, iris is very good for cases of headache, especially with all those symptoms associated with the eyes. You get this blurring sensation or too much of pain around the eyes. So when you see such cases in headache, iris given in potency works a lot. But in this case, I'm talking about migraine. So iris versicolor in a form of mother tincture helps in clearing the chronic cases of migraine drug picture. Now, this is another very good remedy. So what happens in anargus is suppressed menses. So either the female comes up with a history of taking medications to stop the menses due to reasons I wanted to push my menses, so I've taken these hormonal tablets, or the patient is already a patient of amenorrhea. So when you see amenorrhea with headache, history of suppressed menses due to any tablets, this is a very good remedy too. Because again, as I said, contaminated cases, migraine is there. So she is on painkillers. She has taken contraceptives for her menstrual problem, amenorrhea. So the drug picture is not very clear. So, but if you give anaragus, peotida, mother tincture, drug picture becomes more clear, and then you can take the proper case with the proper totality, and then go ahead with your final prescription for migraine. Again, this is a very well-reputed remedy, Justicia. So here what you get is very, very hot, full and heavy head. So the headache is very intense here, and the patient is very, very sensitive to external impressions, very irritable. Lacrimation with profuse fluent and constant sneezing, loss of smell and taste, coryza with cough. Again, this is written in the textbooks. That is why I have added to the slide here. Third potency and higher should be prescribed. Severe aggravation have been noticed from lower potency. This is mentioned in the textbooks. So what, again, as I said in previously, was rare remedies should not be given for a very long period of time, especially in mother tincture form. And it says third potencies and higher can be prescribed. So if you go lower than third potency, you will come up with aggravation. Another very nice remedy which comes up with a very psychological, mental, when we say, and I say psychological, it's a mental presentation. We get this rubric on the mind chapter of our repertory. Along with this headache, this patient comes up with a very forsaken feeling. Forsaken feeling, and there is a tremendous fear of being alone with headache. Again, as I said, this is textbook language. So what happens with the patients clinically? Patients will come and not patients will come and say, or else the patient's relatives will say that whenever my wife gets a headache, she does not allow me to go out anywhere, because if I go to work, she is alone at home, and she fears of being alone. If it's a mother or the child will say, my mom, she gets headache and she does not send me to school because my mom cannot be home alone if she is having a headache. So she makes me sit at home and will not send me to school. So this is usually how the patients comes and tells me. Patients will not be like, oh, I've got a headache, but I've got a fear of loneliness. It's always the attendant. Whoever is attending the patient will give this characteristic symptom, which is mentioned in our materia medica, menianthus, fear of being alone with headache and forsaken feeling. So this headache is a pressing in the head from above downwards as of a heavy weight, and it's very worse if there is ascending. Better during hard pressure with the hand and accompanied by icy coldness of hands and feet. Again, as I said, I have learned a lot from my father. So in my father's clinic, this male patients usually come up with this symptom for the wife, saying that she will not send me to outside to work. She will force that I stay back, and then she comes up with this headache, and then I have to press her hand. I have to put my hand on her vertex so that she feels better. So this is some of the cases of menianthus I have seen in the clinic, wherein fear of being alone is told by the husband, and the husband also says that I have to put my hand, her hand, she is not better, pressing the hand. So pressing the hand is giving that hard pressure, and obviously it's known that man has got a manly hand with more pressure. So menianthus usually feel better with that extra amount of pressure which comes from a manly hand. This is my clinical experience. So as of a heavy weight, as I said, if I'm a migraine patient, if I put my hand is a feminine hand, so I'm not getting that pressure. But a heavy hand can be from my husband or my brother, any man in the house, so that is a heavy weight. Okay, menianthus is similar in some respects to cilicia, but pressure rather than warmth reliefs. Okay, so as said, we have pressure, whereas in silica we see warmth reliefs there. And going upstairs, there is a sensation of heavy weight on the vertex. The headache of cilicia, like that of ignatia and gelsemium, is relieved by copious urination. And so here the textbook, this I have copy pasted from the textbook, Boric. So Boric is trying to say that if you have this case, it might look like a case of cilicia or ignatia or gelsemium, but they all feel better by copious urination. That is one clear difference you should remember. But also in silica, you will see the patient will not allow you to put the hand like this because the scalp is very sensitive. So silica can be ruled out. This is another very, very nice remedy. I have learned, as I said, from many masters. The Calcutta school, there are many masters in the Calcutta side of homeopathic world. So I've seen most of the Calcutta prescribers using this remedy for headache, migraine, and of course, this chronic cases of migraine as well. So Usnea barbata is more like a belladonna glonine. So when you see typical drug picture of congestion, too much of throbbing, sun exposure. The immediate drugs that come in our mind is belladonna or clonine. But I have learned this from the Calcutta teachers is it might resemble belladonna or clonine, or the case could be a failure after prescribing belladonna or clonine. So in such cases where you see belladonna or where you feel this could be clonine, or if you have failed after belladonna or clonine, you should definitely use this remedy. And from the Calcutta masters, I've seen, of course, my father has used, but Calcutta teachers emphasized on this fact that we all should have this remedy in our cabinet. Usnea barbata. There's periodical headache, congestive headache, sunstroke headache. Okay, headache over the entire head from heat, as if the temples would burst or the eyes burst out of the sockets. Congestive headaches sends one to bed from riding in the hot sun with throbbing carotids. So too much of congestion, too much of blood rushing to the head, too much of redness. That is where we see belladonna, throbbing of the carotids. And the only thing that the patient wants is just go away from this world and put himself on the bed, sends one to bed. So that is the only amelioration factor. So that is Usnea barbata. Okay, another very nice remedy is Meliolotus. Do I have time? Okay. What we see here in Meliolotus is again too much of congestion on the face, fiery red face, and the pain is relieved by nosebleed. Okay, the pain is also relieved by menstrual flow. So the headache is always ameliorated by any kind of hemorrhages, natural hemorrhages that is happening. It could be a nosebleed or it could be a menstrual flow. So throbbing headache seems as if the blood vessels would rupture with bloodshot eyes, black spot before the eyes. Headache recurs every at 4 p.m. This is very characteristic. Too much of retching, while vomiting, pressure over the orbits, pallor, cold hands and feet. Sick headache due to constipation, due to scanty intermittent flow of menses with dysmenorrhea and ovarian pain. So again, menstrual pain, menstrual headache, and the patient feels better after menstrual flow. Neuralgic headache over the right side of the head with intense throbbing pain at the vertex and in the occiput due to pain in the cervical and the dorsal vertebra. So there is headache, but there is also too much of pain on the occipital region, and there could be a little bit of uneasiness or the heaviness feeling with this dorsal. So I have seen these patients coming not for migraine. They will be like, I think I am a chronic case of cervical spondylosis. I have done my x-ray. There is no cervical spondylosis, but I am not able to get rid of this headache. So patients might use this language, not migraine, but cervical spondylosis, because Meliolotus does have this sphere of action on the cervical vertebra and the dorsal vertebra. Better by lying down with head eye. Obviously, I've got cervical spondylosis. I feel better if I use 2 or 3 pillows. So that is not cervical spondylosis. That is our migraine case with Meliolotus. Headache is worse from stooping in charge of season, any change of season, with especially rainy weather. And skin and extremities are very cold here. So these are the characteristic presentation for Meliolotus officinalis. Okay, so these are some of the remedies, as I said, it given in the form of mother tincture with water, with repeated frequency, the patient feels better. The patient will not go to the painkillers. After a few days of your 10 or 15 days, the patient is out of painkillers, the patient is no more having the migraine, then you can call back the patient for follow-up, then you take a case, then you go ahead with the so-called similimum or the proper constitutional prescription. So again, we need to understand why rare remedies. Why should I know the pathogenic power of rare remedies? So Dr. Honeyman has explained that physician must have knowledge of the pathogenic power of medicines to achieve the cure from disease. In aphorism 105, Dr. Honeyman told that to acquire the knowledge of the instruments needed for the cure, the natural disease, investigating the pathogenic power of the remedies in order, when called on to cure, to be able to select from among them. So in 105, Dr. Hanneman is clearly saying that we all know what homeopathy is. We all know what homeopathic science, how to approach a case, how to come to a similimum. But Dr. Hahnemann has clearly said that we should acquire the knowledge of the instruments needed for the cure. So as of now, what are the instruments needed for cure? There are some doctors who are absolutely relying on the so-called similimum. There are homeopaths who give rare remedies. There are homeopaths who prescribe bachelor remedies. Some goes for organospecific. Some uses mental method. Some uses miasmatic method. Some use very what was that Dr. Sager's prescription. So these are the different ways of helping our patient. And what are these different ways? This is nothing but different kind of instruments. We all use our own ways and methods to help our patient. So these are the different instruments. So why Dr. Hahnemann is saying in 105 is we should know. And especially here in IFPH, we see different speakers talking about different ways of prescribing homeopathy. So that is a different kind of instruments Dr. Hahnemann was talking about, so why do we need this? So that when called on to cure, what do you mean by when called on to cure? Not every patient is going to come and say, okay, I give you a clear drug picture, give me a similimum. So there are different kind of presentation by the patient. So for all patients, I cannot use mental method. All patients, I cannot use Dr. Shankaran's method, or else I cannot use Dr. Praful Vijaykar's method. So there are different instruments. So I have to decide what is asked by this patient. What is this patient asking for? If the patient is telling that I'm on painkillers, and if the patient is telling me that I am giving you only few symptoms, just 2 or 3 symptoms, then which method will I use? Can I use a mental method? Can I use the ideal Kantian method of asking the entire case? And all? That's not practically possible. So in 105, Dr. Hahnemann is saying, when called on to cure, you should know the different instruments so that whatever the patient is telling you, you should be able to prescribe him at that point of time. And that is why he has mentioned in 106 aphorism that the whole pathogenetic effect of several remedies must be known. So what do you mean by pathogenetic effect? That is where these rare remedies are. So the rare remedies, especially in the mother tincture form, works on a pathogenetic level. So we need to know the rare remedies. We should know what is the sphere of action of this rare remedy so that if needed, not all patients should be given. If needed, in certain particular situations, we should be able to prescribe this rare remedy. It's very essential to understand what are the advantages. Also, what are the disadvantages? So, because as homeopaths, we have been trained and we have been strictly given guidelines saying that similimum, the word similimum holds a lot of importance in our prescription. So, we all try our best to give the best so called constitutional prescription or the similimum to the patient. But we should know when should we use rare remedies. So rare remedies have specific action on the human body. Some drugs act well in specific disease acts. Why this is important is when we talk about belladonna or glonine or spigelia, we also know that not only for migraine, for many other diseases, I can use spigelia. But when you talk about rare remedies, it has got specific action and it can be used for specific disease condition. This is very essential. So these are not polypills. Selection of a medicine is easy on the basis of the disease diagnosis. So when rare remedies, you can very quickly select the remedy. And where do we need such kind of a situation? When detailed case taking is not possible, when patient is unable to describe his suffering. This can be prescribed in non-availability of the patient. When patient's relative is asking for the treatment over a phone call, when complete case taking is not possible. Rare remedies helps in palliative treatment. This is very, very important. This is not going to help your patient 100% forever. This is palliative. And when you have to give quick action, obviously the patient is suffering, coming, sitting in front of you and screaming out of headache, and he is not even ready to give you the case. Obviously, he is not in a position because of the throbbing of his carotids, etc. So what can you do? You have to give quick action. So rare remedies are very helpful in such situations. The relative calling up and asking, doctor, my wife is having so and so, what should I give? So such situations, rare remedies will give very quick action. Disadvantages are immense with rare remedies, and this knowledge is very, very important because as homeopaths, what happens, I have experienced is one of my friend during the initial days of practice, we went for a seminar which gave elaborate understanding of the rare remedies. She understood that and she learned from that and she practiced. And she was successful in her practice because of the usage of rare remedies. But she got addicted to this kind of prescription and she started using more of the rare remedies for most of her patients. So that is very dangerous. So we need to understand the disadvantage of rare remedies, because this is definitely going to help us in our practice. But we should also understand rare remedies is not a curative treatment. I have written in the red line in the slide, it is not curative treatment. Our curative treatment for a homeopath is always the similimum, constitutional prescription or the similimum prescription. So patient can have adverse drug reaction. This is one of the disadvantage that we all should be aware of. You cannot rely on its action. Prescribing rare remedies on the basis of few symptoms can be a hit or miss or hit. Few or no characteristic symptoms, as we discussed, detailed information about the drug is not available. Again, when I have given a couple of remedies here, I think almost 10 remedies I have explained in the slide today. But if you go and look for the details in the books, you may not find details in all the books. There are some books or some websites in the Google, if you see, you will get, but you will not get detailed information of all the rare remedies everywhere, unlike our polycrest remedies or unlike our well-proven remedies. So that is one greatest disadvantage. So as I said, I have benefited because I have learned more from the masters rather than books. But if you want to take more information from the books, you will not get very good information of all the rare remedies in all the books. These are the list of disadvantages of rare remedies. So again, as I mentioned earlier, rare remedies, just one drop of mother tincture in a cup of water, a teaspoon to be taken immediately and repeated every 15 minutes till relief. The moment the patient is relieved, you can ask him to stop the medicines. So what happens after using this rare remedy? As discussed, the patient is going to come out or stop with the dependency on conventional painkillers. All the suppressed symptoms will resurface and you are getting a very clear drug picture. So I think I've finished with my time. So the take-home message is use less known or less commonly used rare remedies to get a clear drug picture and thereby reach a minimum in case of chronic cases with history of suppression. So this whole session was about this, and this is the take-home message. So with that, I would like to say thank you very much. And I would like to end the session here. Unfortunately, I've left with only 2 minutes to get any discussions done. Very sorry about the timing, but thank you very much.
Only one participant can ask one question if anyone wants. Otherwise, we'll move to the Malayalam session. And it was wonderful. Anyway, you have discussed the disadvantages also, because whenever we are hearing about some rare remedies, it's a craving for using
Yes.
rare remedies and how
very true.
Something. And really appreciating you discussed about the disadvantages also. Thank you so much.
Thank you very much. Thank you.
You shared great things to us. Thank you so much. Dr. Ram Parvesha, sir, you have only 1 minute for the appreciation. You can
Very sorry. I'm very sorry. I should have finished a little earlier. Sorry about that.
Sir, unmute yourself and you can talk. And Mariamma, doctor, I am making you as a host, okay?
He's not able to unmute, Dr. Ram.
Dr. Ram Parvesha, I don't know what happened to you.
Yeah, he's got unmuted.
Thank you, Dr. Padmapriya. Very nice.
Thank you, sir. Thank
you. Migraine disease. Migraine disease, only one, suppression of emotional, main cause of migraine, and excess use of drugs, main cause of migraine. Thank you, very, very thanks.
Thank you,
nice,
sir.
nice, excellent session. Thank you.
Thank you.
Thank you very much. Thank you.
Thank
Now
you.
we are moving to Malayalam session. Thank you, Dr. Padmapriya. Come again.
Thank you.
Your knowledge is here. We want.
Thank you very much.
Thank you so much. Love you. Bye bye. Good night to everyone.
Thank you. Thank you very much.
Mariamma John, please welcome.
നന്ദി അച്ഛനും ഡോക്ടറെ.